watching AYV Television.
Me mommy them,
me daddy them,
me sister them,
me brother them.
the time don't come, oh, the time don't come.
For make we tinap longer one for fed food insecurity in a salon.
Baku every day now for you who want be farmer and you when a farmer.
Una where they throw away food now na host them.
Do ya with the bake una, make una give the one them we not get.
Also, una can donate any food item to feed the hungry Sierra Leone.
We don't tinap king for feed the one them where they suffer for tea for it.
This message comes to you from Feed the Hungry Sierra Leone in effort for support the government in the Feed Salon campaign.
For donate, call 073-88-8340.
Or you can call them now 033-6812-64
or 031-688153.
Family them. Now the one that told, let we all join hands together for feed we say. Good afternoon, listeners and viewers. Welcome to another educative edition of Feed the Hungry Sierra Leone. Healthy living, healthy people, healthy nation show right here on AYV TV and radio. I'm your host, Alice H. Sise, and it's my pleasure to take you through with us.
Good afternoon, listeners and viewers. My name is Amida Suma. I'm your co-host. Today, we explore what defines a strong nation, our health. As a common saying goes, a healthy nation is a wealthy nation, and it holds. Healthy living extends beyond avoiding illness. It encompasses our daily choices, including our diet, air quality, and stress management.
Well, Feed the Hungry Sierra Leone Healthy Living Public Health Education is to put together a comprehensive psychosocial support interventions that is aimed at addressing life conditions that includes the mental well-being and on individuals through a tailored weekly health education outreach to contribute to a healthier community and a stronger nation, because health is a blessing.
In this session, a medical expert will provide a valuable insight about the causes, effects, and prevention of monkeypox, a viral infectious disease. We encourage you to take advantage of this opportunity to enhance your knowledge, whether you're at home or in your vehicle or on the move. By staying informed, we can collectively work towards preventing the spread of this disease in our country.
Oh yes, so don't change the dial and stay with us as we embark on this journey towards a healthier living, because Feed the Hungry Sierra Leone and the Sierra Leone Medical and Dental Association values the health of its nation. As we live better, we build a better future for ourselves, our families, and our nation. We have with us in the studio our wonderful and beautiful Dr. Agnes Bangura, a case management program manager at the National Public Health Agency, to tell you about smallpox. So, Mrs. Agnes, welcome to the Feed the Hungry Sierra Leone Healthy Living, Healthy People, Healthy Nation show. You're here to tell us and educate us about monkeypox, prevention, care, and everything. You're welcome, ma'am.
Thank you. Welcome, Mrs. Agnes, or shall I say Dr.
Dr.
Bangura? Okay. So, firstly, to start, can you please educate our people on a brief background of monkeypox? Because I know this is one of the major questions asked. What is monkeypox?
Thank you very much. Good afternoon, listeners and viewers. Monkeypox is a viral infectious disease that is caused by the orthopox virus. So it affects different parts of the body. and we have been having series of outbreaks in Sierra Leone. So this is not the first time, but the one that has been affecting people in Sierra Leone. So we have the West African clade, and then you have the current one that is ongoing, that is the Congo Basin. So the Central African one, which is more infectious and more transmissible than the one that has been happening in West African region.
Wow.
So we recorded the first case of monkeypox. It's now called Mpox. It's the same, monkeypox, Mpox. So we recorded the first Mpox case in Sierra Leone in 1970.
Wow.
So it's not a new disease,
Okay.
but we are scared of the introduction of the Central African clade into our community, because that one is more infectious, much more transmissible than the one we have been experiencing in Sierra Leone. So for community people, if you see someone with an unexplained rash for the last 21 days, so it has an incubation period from 5 to 21 days. And then it also has different stages. So you have the invasive stages, the invasive stage and the skin eruptive stage. What I mean by that, when you say invasive, so it's within the body, and you will have fever, you'll be experience muscle pains, we call it myalgia, you'll be having asthenia, so severe profound weakness and things like that. And then when it becomes, you start having skin eruption, then that's when you can transmit the virus. So you will not transmit the virus until it becomes visible on the skin. Okay. So most of the symptoms are, it starts with the face, the rash, and then some move to the extremities. So basically that's smallpox. It's diagnosed mainly clinically. So you have to be seen by a medical doctor or clinician, and then it can be confirmed using the PCR, the polymerase chain reaction. So you have to take, you don't do, the difference with this monkeypox, you don't take blood sample to the lab. You take the pus, so the pus from the pustules, and then you, so I don't know how to say it in Creole.
Talk it, say it in Creole with a mix.
So like the tough or the water where they inside the boil, now they take, okay, go na lab for let them go do analysis.
Oh, so now the tough.
Yeah, or the water where they inside the boil.
Okay.
Then when you don't come out from that stage, they become crust. So like where you get crocro, so they peel off. So that skin sample day, we can take them as well, go do analysis parana lab with the same PCR testing. So basically, nadandina monkeypox, and it also feed by other sickness.
Oh, yeah.
I just want to ask
Yes.
you, because like Bokuman, they go mistaken for smallpox, where they call chicken pox, and you know, we get smallpox then we get chicken pox. How you feel say this relates to them? Okay,
if fever, right? Chicken pox different from smallpox.
Okay.
Smallpox and we don't eradicate around the world, I think in the early 70s. So people they don't make a vaccine. So obviously with a vaccine you're able to eradicate disease. Even I will come back to the Ebola. Now we get Ebola vaccine. If people then get sick with Ebola, then can get them vaccine, that vaccine day. So vaccine been there for smallpox. So after some time when people they get this sick, then don't give them the vaccine. So they stop the new infections then.
Okay.
So for this one, Epheba varicella. So Epheba chickenpox, because it get the same stages where you will begin get fever, your body they warm, you get a bad fever, you they feel tired, then you get rash.
Yeah.
But this iron rash different from chickenpox iron rash, right? Chickenpox iron rash mainly can start from inside the trunk. Whereas this one is even more concentrated in the face as well.
Wow.
So it differs slightly, and they're all two self-limiting. So, but with chickenpox, because it affects the nerves, you will still say painfully, they scratch. But this one a bit less, they affect the nervous system less than chickenpox.
Because I be one just ask how possible able clarify say this na mpox and this na chickenpox.
So for the one that we done at the community, like we get community health workers then. So the community definition for a suspected case, now where person gets rash, we don't know side come out for the acute rash for the last 21 days.
Okay.
So send that person in a hospital. And mainly in a clinical diagnosis. So when you see the person, you take in history, you examine them, then you go able to get a suspected case. You go able to get a confirmation when you send the sample, go in a lab for PCR. Then it come back, then you get a definitive diagnosis of mpox.
Okay. So, because we see how Ebola and Corona take a run in Sierra Leone, and now this they go around now West Africa. So, I just want to know what are the preventive measures they want to put in place, especially for high-risk environments in Sierra Leone, and how you were able to educate people them for taking measures and they follow them not contact them at all.
Okay, so for prevention, the National Public Health Agency, when they in charge for any emergency or any outbreak in the country, they don't form that agency recently. So we get different pillars then or programs then within the agency. So me na one part the program manager they were in charge of case management. In case we get mpox now, different we get the risk communication team, then they out to do their work. Surveillance obviously don't be heightened. We even get the point of entry. Now they do screening at them border districts then, because they fear now for let we not import this one where they go on around the world, especially the one where they the Central African basin, because that one is very transmissible and infectious. So all anything and they do, and then people that way they hunt animals in a bush because the zoonotic infection. So it means to say that from animal it will be introduced into the general to the human population. Then from human, then we begin transmit until we safe, right? So we need for cut the transmission from animals to humans. And how we can do that one day? No go too much na the bush then. If you want for we try not for eat bush meat. Even when we get beef or beef, let we cook them properly, because uncooked meat self can transmit the virus. Yes. So then obviously if it don't reach that point where you get the rash, the pustules and the vesicles, the pustules and all that, and they try for limited contact. So right now we try for rehabilitate the holding and treatment centers there. So just part of the preparedness state. We don't want to wait stay when we get the first case, then all man begin running like what may happen in the past. So now with the systems, coordinations are better. So we go able to see how we can able for tackle them immediately if we get any case. Now we don't get cases.
I see you mentioned the roadside we fumble network side, we side the road then connect with other countries. Then what about the airport? Any arrangement there for there?
Yes. Now the risk communication team, the point of entry, then get their own program portfolio with themselves don't be activated. So all inside and there. I think now if you even go to airport, you could see a Mpox banner there for just try for educate people there. And then I think they don't even start for do some screening.
Okay.
However, we for no say the people already travel at the Cambia, Pujeo and Kailang borders, the more than the one that already can Lungi.
Okay.
So don't just limit we safe to just the one that already come from overseas or by plane. So we don't do the airport and the border district sensitization.
So we get any guidelines?
Yes. Last week now we revised the case management guidelines. So we want for start for do training of healthcare workers because mainly the diagnosis are purely clinicals. Okay. Even if I can talk to tomorrow, we as clinicians, we only are different from what you go see.
Exactly.
So we don't get the guidelines has been revised. So we go get for start for do cascading of the trainings and see how best we can reach all man in case we get in the first case.
Okay, so earlier you mentioned say it take like 5 days and also it come as a rash, right?
Yeah.
Then it takes like 21 days for Leone able for dictate say it's Mpox. So my question is, what are some of the own challenges the one that they get for able for diagnose and say this is monkeypox? Because obviously there must be challenges as it's a new infectious disease. So what are the challenges you guys are facing?
Currently, I'm not going to say there is much of a challenge. The one thing for diagnosis because it fever other diseases.
Yeah.
So one thing you get for be very, very good with the clinical skills. So when you suspect Mpox, you alert the authorities.
Okay.
Right? So we get the surveillance team gets the network where they get messages, even now we phone them for alerts people within authority. Then if you suspect Mpox, you just take sample. We get 5 reference laboratories then for where they do PCR across the country. We get P3 lab, I think we get McKinney reference lab, we get Kenema, and then we get the public health CPHRL, public health CPHRL. I will manage that.
So, this is not a question anyway. I'm just advising that you guys should also sensitize people about this, because now you are saying this, but not all people will be fortunate to be looking at it. So I think there should be a sensitization program going on to sensitize people about this, so we avoid the spreading just like Corona and Ebola. So
that's ongoing. Last week there was community engagements even in Cambia, I think.
Okay.
So Cambia or Kailang, I can't remember, but the surveillance team, the risk communication teams, they're all outside, especially in the priority or the high risk district. So Cambia, Pujao, Kailang, even western area, because of the water, the rivers, then people can come in. We even get people from Guinea through the boats and all that kinds of side and they. So then side and they really they go on with
targeting the borders
for now.
Okay.
Because
nice.
they forget for the importation.
Yeah, exactly.
Yes.
Okay, Dr. Agnes, thank you very much. Listeners and viewers, as you can see, this is the Feed the Hungry Sierra Leone Healthy Living, Healthy People, and Healthy Nation show. You can join us through the number 079465909. I call again. You can join us via SMS, messages, questions, call on 079465909. So, Doctor, With that being said, how now they try for manage this, especially for picking them, young children, pregnant women, lactating mothers, and the old, because they are the most vulnerable people in society. Then go hardly recognize waiting they come to them. So how waiting are the things that one don't effect for put in place for able tackle that?
Yes. Last week we get engagement with the partners then. So because the most vulnerable and the most at risk population are younger children, especially in this monkeypox.
Yes.
Yeah, exactly.
Then with MSM, men who have sex with men, they are more at risk as well. So we don't engage with partners then. See how they can able for support. We don't even, because most of the symptoms, the symptom treatment now, okay, the treatments are symptom specific. So if person gets the rash and the pustules, we will get antibiotics.
Okay.
But we not get the guidelines where we get already, not include the dose for picking them yet. So we decide for engage the pediatricians then now, for see how we can do the dose based on the picking them body weight, because obviously when you give picking medicine, you get for weigh and force before you get medicine.
Yeah, exactly.
So we don't engage them, so we go get for add down and out to the treatment guidelines. We will therefore go and disseminate to the healthcare workers then nationwide. For
The
old people, them pregnant women, we don't engage with partners there. We get partners there where they work with vulnerable people. Then also the
disabled.
Partners in health, then self get the support. We get different partners there where they come in for support, different group of people there. So we don't engage them. They don't. Then they try for commit themselves.
So like everybody, they try your own department for waiting and waiting on go able to tackle.
Yes.
Okay.
So for case management, now that day we don't do. So surveillance themselves get their own thing they wouldn't they do. Points of entry get their own thing they wouldn't they do. So different programs under the National Public Health Agency get different thing they wouldn't they do for. Even if we get the case, that we able for contain and enough spread.
Okay, thank you. So you mentioned pregnant women, right? So back to my next question. This disease, how it affects the pregnant woman? Like how exactly, if it will affect the pekin inside the womb or not just the woman we get the belly? Just try for sensitize people on that.
When person get belly, anything do because the blood within your body they circulates through to your pikin.
Okay, yeah.
So obviously, if you get mpox, it depends on the severity. So waiting we dey try for do for law we try for prevent and let not cross to that pikin. So early detection they save life. So if you see anybody we get, you don't even need for be pregnant where you get anything unexplainable, you get rash where you know how you come out. Insects not bet you, not gonna bush, you know get moot not bet you, mosquito not bet you, you know get chicken, you know take any medicine because the rash themselves you can get drug reaction we can give you the rash and you know remember so you take any drug kind of hospital.
Yeah.
So because when monkeypox come out, everybody gets their own idea and explanation. So now Gladys say they talk to the experts, we're going to educate we more. Some people then they try for toxin a high infection and they cause monkeypox. So I don't know how you go able to clarify that.
High infection.
Yeah, no high level of infection at the body.
No, virus. So
okay.
It lead to buccal complications.
Okay.
There. So the complications you can even lose your sight. Obviously, if you get pregnant, you go abort the baby and then kind of thing in there. Then you will get blood problem, pneumonia.
Okay.
So I know, so I know some people that go get a blood problem. Yes, yes. So then kind of complications and they can arise, but it got to do with the level of the virus in your body.
Okay.
All right. So for local areas, how best on don't put up infrastructures, or even if not put up permits, because since we know record cases, but waiting at the implementation when I don't put in, especially for these borders, like for infrastructures, where if person gets a lot of pass, then go on come out and at home, we go able to help out, and also the diagnosis for sensitize some doctors and stuff in these local areas, where we able to help people them out.
Okay, so thank you very much for that day. So one lesson where we learn from the Ebola, now follow we not transfer patients then.
Exactly.
So if you sick na Cambia, we're not expecting for can put local. No. So what we don't do now, we don't do assessments nationwide for all the facilities. So each hospital forget one ward we dedicated for manage any case we get where we say now monkeypox, because you get for isolated, the IPC team get for do the thing, they get for do the PPE dressing and all that kind of thing, because what we don't want we don't want let the people themselves where then at the community can infect with healthcare workers there. So I make with train the healthcare workers them on how to put on and take off the PPEs as well. So all the government hospitals there don't be assessed. The one that we need rehabilitation and support for let them come up to the optimal level. The plans they on the way for go initiate or start the rehabilitation processes then.
Okay.
So all the government hospitals them I know, because we do assessment where they send the status reports to we, and we don't see who side and get gaps and how we fill the gaps then.
So as this monkeypox here, we all know say na be very old disease, as you self don't clarify them. When I get any medication we be done there on standby, like for care, for prevent, or in case they notice say this na mpox, na get any vaccine or medication for give an individual there for stabilize them?
We get maclate, vaccine where then we don't produce for mpox, but because luckily it's similar to smallpox, sorry.
Okay.
Vaccine there for smallpox. Okay. So potentially it will cover for mpox. Then we get medicine with na antiviral medicine, but it's not readily available. As a nation, we get for apply, then they can give you some component or some quantity we will get for stock. The application process not start yet, because then you get boku thing that we get for going to the application process. Okay. So that's been done in the background. So yes, but mainly mpox na symptomatic treatment. If person get fever, you get medicine for let in body cool. If person get rash, you get medicine for dry the rash, and even it dry, you can get moisturizer for let the rash not the catch and too much, let no peel. If you get the antibiotics, so basically na symptomatic treatment. Okay. Now this mpox they work with here.
Okay, so you mentioned antibiotics, so you can recommend some antibiotics.
No, anybody who is sick like in hospital.
Okay, so certain people they're just that stubborn. Especially when it's about chickenpox. Yes. Someone will just say, "Oh, these are just chickenpox."
And because na viral infection, if you take antibiotics, exactly. Antibiotics now for bacterial infection. You need for go to hospital, then go treat you accordingly.
And mostly see this kind of program here now, that's now one of the reasons for let we encourage people that for able to go to hospital. Because waiting make some of them diseases they go out of control. A lot of people sometimes then kind of say this kind of rational go there by you, then begin say okay, Lord go country way. Yeah. Then begin go treat and country way, not knowing that they can over infect them and it even distribute them to the people that are around them, you know. So now I make with the advise people them when you see something where you know one day see, or when you don't see something where they feel say this is call for medical attention, go to hospital. I know say we have herbalists are not good, yeah, the country where they work, yes, medicine they work. But go first now hospital, let you make sure say they're able to know waiting really do you, waiting happen with you, waiting are your problem. Let them diagnose your problem, then you will know now if you for go country way or not. So doctors can even advise say go country way, right? Yes, advice, no trust. Now the problem is Sierra Leone, we they feel say no more country way medicine not okay. But you just tell like Ghana and the rest, they get the herbal medicine them. Even at the young hospitals them, where they feel say okay, this now herbal medicine, they not bottle, they don't arrange already, they give you. Yeah, but then they don't do tests. Exactly. Those things, I know they even go there. I know that me not a traditional healer.
Okay, so since you're a traditional healer, but you're not a medical person, right? So now, if somebody gets monkeypox, then they don't go this traditional way, then later they get for wash with them. So like waiting, how it will affect the treatment? Like now you don't get a traditional treatment, then now they don't wash with you in the hospital before they can get the English treatment. So how this will really affect the person?
So the people that they at risk for get severe cases of monkeypox. Now people there, like I don't say small picking there. People that will get diabetes, people that will get chronic liver disease and chronic kidney problem. And with their herbal medications here, because the concentration of the chemicals they will
Doctor, me I don't cut you, but I need you for take a break because honestly, this education you necessarily need them. I want let you take a break. So viewers and listeners, we will go for a short break and we will come back. Not change the dial. Stay with us at AYV. Because we get beaucoup where you need for know from the Feed the Hungry Sierra Leone Healthy Living, Healthy People and Healthy Nation show.
Me mommy them,
Me daddy them,
me sister them,
me brother them.
the time don't come, oh, the time don't come.
For make we tina longer one for fed food insecurity in a salon.
Baku every now for you where one be farmer and you when a farmer.
Una where they throw away food now na host them.
Do ya with the big una, make una give the one them we not get.
Also, una can donate any food item to Feed the Hungry Sierra Leone.
We don't tina king for feed the one them where they suffer for tea for it.
This message comes to you from Feed the Hungry Sierra Leone in effort for support the government in the Feed Salon campaign.
For donate, call 073-88-8340
or you can call them now 033-681264
or 031-688153. Family them.
Now the one that let we all join hand together for Feed the
Monkeypox has been around for years, and it really causes a rash that's similar to smallpox. And so with the elimination of smallpox in the early 70s is when monkeypox was discovered. So it starts off with fever and then general body aches, malaise, muscle aches, similar to influenza. That usually precedes the development of the rash. And if people have looked online and seen the rash, it starts off as a macule, a flat raised lesion, but then it forms a firm nodule that's really hard to miss. From there it develops into more of a blister and then a pustule, and then it scabs over. Generally, the transmission occurs due to prolonged skin-to-skin contact or it may occur with respiratory contact, but these are large respiratory droplets that don't travel far. So the CDC considers you being at risk as if you're with somebody who's infectious within 6 feet of them for 3 hours or more. And I think that goes to show you how much less infectious that is compared to something like COVID. People may be infectious as soon as the prodrome starts, the fever and the not feeling well, and then they stay infectious throughout the rash until the skin is healed over. You know, the smallpox vaccine has some cross protection against monkeypox, so it is being made available through public health for people who've had contact with confirmed or suspected cases of monkeypox. If it's given within 4 days of exposure, it protects about 85% of the time. But even if it's given after 4 days of exposure, if it's given up to 2 weeks after exposure, it may modify its disease, making it less severe. Monkeypox generally, people who have it, they generally recover on their own, but about 5% of people who have monkeypox may die. The current strain, however, causes less severe disease and is expected to have a mortality rate of about 1%. Treatment is generally supportive, but there are some antiviral treatments that are available, as well as immune globulin that's available. If people have had suspected exposure to somebody with monkeypox to a confirmed or suspected cases, and it's a significant exposure, then contact your healthcare provider, because then they can refer you to potentially get vaccinated to prevent infection.
Me them,
Me daddy them,
me sister them,
me brother them.
the time don't come, oh, the time don't come.
For make we tinap longer one for fed food insecurity in a salon.
Baku every day now for you where one be farmer and you when a farmer.
Una where they throw away food now na host them.
Do ya with the bake una, make una give the one them we not get.
Also, una can donate any food item to feed the hungry Sierra Leone.
We don't tina king for feed the one them where they suffer for tea for it.
This message comes to you from Feed the Hungry Sierra Leone in effort for support the government in the Feed Salon campaign.
For donate, call 073-88-8340
Or you can call them now 033-681264
or 031-688153. Family them.
Now the one that all let we all join hands together for feed we say. Hello viewers and welcome again to the program where we call Healthy Living from Feed the Hungry Sierra Leone. So Dr. Amida, fire doctor that question mark really ask her.
So, hello viewers and listeners, we are back again, and we already know, if you were listening before, you already know, monkeypox is a very infectious disease where they go on right now. So, my question was, if somebody don't go through the traditional way, because we know people, especially local people, once they begin experience something, the first thing they go on to that the traditional way. So imagine you don't go through that, then later realize, say, oh, this is not something when it's traditional, and come to the English medical doctors but try to see what's going on. How una go able to help these people out? Like,
I know the local, nothing to say. People always get reason when they do anything. So if somebody go see herbalist or traditional healer, not say herbalist, traditional healer, it must get reason. So we they against that because one, the medication they way then they give probably not get dosage.
yeah.
So and the more you they take then medication in there, it unbog your kidney, it unbog your liver. And from studies, it don't show we say people then we get liver problem or we get kidney problem, they are then more susceptible to severe complications of mpox. So we know one day because
more vulnerable.
Yes. So if you get complications, it will be difficult for manage and you get tendency for die. So basically, not take herbal medication when you sick, turn to healthcare workers then first. And the other thing, the denial. So now that's make we get this communication because not for you no more. Remember that picking at us. Remember you fumble them. Remember say if anything happen, if this will not able to contain this virus, it go and bug we all in this country. So not just think about yourself, think about your picking and the whole country.
Exactly, but there are still stubborn people out there, I know. So like una don't put any preventive measures for able to help them out immediately, like because there are still stubborn people out there, even they will still go ahead and do them, but una don't put any preventive measure. If they can't case then they come, I will not be able to help them out.
Okay, so each community, even the last village now, this country, get community health workers. So community health workers then are people that they within the communities, then we don't give some basic training for if you this person get malaria from down there, I can know say then they give them some medication where then they treat people with basic uncomplicated malaria. So if men, so then they go to the host every day, even for people that get tuberculosis. So then they go to the host and they follow up there. So now people are already within the community, they don't give some basic training. So now then people and they still use as for support in the risk communications for disseminate this information. So when person gets sick, when you see unexplained rash, you know say this rash come out, go to doctor. So then people and they support we and then communication there. So they tell them say where you sick kind of hospital, where you sick kind of hospital.
Okay. You mentioned say uncomplicated malaria. And I'll be say uncomplicated malaria day and complicated malaria day. So now that you've mentioned uncomplicated malaria, I believe say go on for tell family the what do you mean by complicated malaria and uncomplicated malaria. So now we learn.
We're here to learn.
Okay, so malaria, the uncomplicated one. Now the one way it depends on the parasitic load as well. So the parasite count in your body, how you they feel, the fever, the grade. Then they can take any anti-malaria well. You don't need for take intramuscular or intravenous. No, you don't need for take that. When you reach to the complicated stage now, for picking them more, you go down reach to anemia. You go don't begin get convulsions. You don't begin get severe weakness and all that and so then they can even lost consciousness. So then I get for begin rehydrate them, begin give them all kind anti-malaria intravenously and all that kind of thing. So when they reach that stage, the normal manager now. No?
Okay.
Yes.
So at least thank you. With people that don't benefit from monkeypox topics, we also teach them about malaria. So back to monkeypox. So what is there any changes in the vaccine update? Maybe say technology they improve every day. Maybe we don't update the vaccines because the last time it happened in 1970, right? So from that time to now, are there any changes we don't suspecting that if we do for update the vaccine so it could be more effective this time around?
Like I said, the vaccine we did now currently now the one for smallpox.
Okay.
Because they're so similar, they cover the strains of monkeypox. So it's still in a lab.
Oh, okay.
So it in a lab as in if they want it don't get license. So they don't have license vaccine. I'm not saying in a lab because in a lab means to say no license it. So it don't license already. So in case they need for do any investigations or anything, then go still they do in a lab. But if they need reach now for let them say they use that, then go still use that. It go still efficacious.
Okay. Yeah. So is it been tested? It
has been tested. They don't go through all the clinical trial stages. They don't even license them. They don't use them for smallpox. They're able to eradicate smallpox from the world. So it don't be tried and tested and proven efficacious. So that's it.
Okay. So Doc, you know, in Sierra Leone especially, whenever somebody feels sick, whenever you're not feeling well, when you go to the hospital, the first thing they try to do is to give you drip, you know, and then some of them sickness they are so we just they come up in real time where we not be ever know of. How you feel say if they go give drip go affect you? How dangerous you feel say it will be to this smallpox where we they talk about this mpox how they talk about?
That one is a tricky one. If person sick, you go to hospital. Now make now the one thing would they do now for train with healthcare workers on the case management of monkeypox. You know, come now hospital. You tell me say you teach that, I give you drip, right? So the healthcare workers there, they are trained. They know they are not sure say you go come with rash and say you get what you go say. They can't diagnose you say you get monkeypox, where you know they vomit, you know weak, you know get any complications, then they start to give drip. So we know they train people there for give people the drip. Okay. So the problem we get, I understand which side they come off from. People then can say me if you not give me drip, I know they well. So we discourage people then from down there because we don't want to let you get fluid overload. Yeah. Because if you get fluid overload, it will give you heart more work for do and it will lead to heart failure. So all anything the medicine not to one being they learn them, right?
Yeah, so, exactly.
Yeah.
Yeah, but it's nice that when I already desensitize people on that because you get such people they tell you say, I mean I drip no more they work for me. So they tell you say na medicine no more me I don't like deep safe na medicine Alex. Yes. So there are stubborn people out there, but it's nice you guys are doing your job. So
yeah. So Doc, have you people put in place any preventive measures waiting for tell the public and people that really watch waiting at the preventive measures for avoid like corona the time we become then they put bucket then at the checkpoints there you can't on you wash your hand and they tell you say no near pussy not this you know where you want cough cover your mouth and all. So waiting at the preventive measures the one I don't put in place for the mpox.
Okay, like I say, because na zoonotic infection, try for minimal contact with animals, okay. Right? So, you know, we jump from infected animal to the human population. That's number one. Then cook your beef very well. So now eat raw beef. Okay. No, because we know say they come from monkey, but we don't know other human reservoirs then probably go there. Okay. But we don't get no evidence of any human of the other animal reservoir. Yeah. So we need to be precautious and just take necessary steps. So if you want for cook, not eat raw beef. People know they eat raw beef. Cook your food properly, and then if you sick, go hospital big. Basically, and then when you sick, no hide person at house, can go to hospital. Try for minimize contact. The IPC team they do the regular support with hand wash, the bucket, and also then they do. Then they're on the process for good food and distribution and things like that. Then they are new. So basically, I don't think they so you get for the wash your hands regularly. If you touch somebody who is sick, that make even the rehabilitation of the treatment wards or treatment unit where they go, the thing they will look for, then forget running water. So any side we not get running water, we try for see how we can put water there for the healthcare workers in there before wash their hand, because no one for can cross infect people that we admit in the hospitals time.
All right. So, what are some of the common mistakes you learned from your past infectious diseases like Corona, Ebola that you public health people don't want to repeat? So, what are the mistakes and the lessons you have learned from them?
The one problem we been get during the Ebola and the COVID, preparedness. We were never prepared for them. So now with the public health agency, primarily their work now for make sure that the country always prepared for an outbreak.
Okay.
So you get the surveillance team, you get the IPC team. Okay, so you get about 3 directorates, now the public health agency. So you get the director of biomedical services, you get research, you get I think the one with surveillance day on that. Don't forget the not to that directorate. Probably not make. The preparedness state. So now with all the arms and they're not been there before Ebola.
Yeah.
They're not been there. Okay, during Ebola they set them up.
Yeah.
So say it did form now like a baby. You get for go through the neonatal stage, the toddler stage.
I guess that will be if it help for the corona, not if it spread like
exactly. So you will notice say with corona we able contain better than Ebola. So now with Ebola corona experience, now Mpox, we try for be prepared. And for the coordination self now be other challenge. Okay. You don't know that for reports too. Yeah. You don't know that for go talk this. But now all them things they don't be established, kind of. Okay. So it will be better. It's going to be better coordinated in case we get another outbreak, because outbreak they always get for the happen.
Yeah.
Okay. So we just got to be prepared.
Thank you very much. Thank you very much, Doctor. So waiting at your last word to people them about Mpox.
Mpox na new sick we know wale inside saloon. Na the clade where they circulate now, we know wale can a saloon. So they are big. If you feel say you sick, you didn't Guinea, you didn't Liberia, no can saloon.
Especially with that Mpox.
Okay, all jokes aside. So if you feel any way where you know comfortable, you feel extremely tired, apart from the way you normally feel, go hospital. If your body warm, after more than 3-4 days, your body they warm no more, you drink medicine cool, after 2-3 hours you warm back, go hospital. Then if you get suspected case, you get the surveillance contact where then they send updates. Do you have big una go they send message there. If una see anybody where una feel to send a Mpox, una send message. Okay. Then the beef, the hunting, let we blow small until this one pass away. If we you want for eat beef, cook them properly, no eat raw beef, then protect yourself basically. Okay. Very long sleeve if you're gonna crowd, because you will know say now when you get the rash it become infective. So basically anything they will for do.
Thank you very much.
Okay, thank you so much, listeners and viewers. I hope say una save dollar learn a lot, because even we save dollar learn a lot from we able Dr. Bangura. So I hope say una save dollar learn, and we all will be glad how Ebola and Corona affects the country and how it really from doing certain things then during that period there. So it only takes a collective handwork from we all for make we able to help this out. So thank you so much for listening today.
Thank you, listeners and viewers. We appreciate you now as we did all the cutting now for Feed the Hungry Sierra Leone Healthy Living, Healthy People and Healthy Nation show. A very big thank you to we own president, we CEO, then Mr. Dennis Gray, and in beautiful wealth, Mrs. Gray. We tell you now thank you and thank you to all the staffs of Feed the Hungry Sierra Leone. We appreciate you now help and support. Until next time, we also tell the doctors, Sierra Leone Dental and Medical Association, thank you for waiting and joining with we follow we give people in this well body talk here. Until next week, we say goodbye.
Me mommy them,
Me daddy them,
me sister them.
me brother them.
The time don't come, oh, the time don't come.
For make we tina longer one for fed food insecurity in a salon.
Baku every day now for you where one be farmer and you when a farmer.
Una where they throw away food now na host them.
Do ya with the bake una, make una give the one them we not get.
Also, una can donate any food item to Feed the Hungry Sierra Leone.
We don't tina king for feed the one them where they suffer for tea for it.
This message comes to you from Feed the Hungry Sierra Leone in effort for support the government in the Feed Salon campaign.
For donate, call 073-88-8340
Or you can call them now 033-681264.
or 031-688153.
Family them. Now the one that all let we all join hands together for Feed the
You're watching AYV Television.